Have you ever wondered what to do in an emergency situation? It's a question that's crossed all our minds at some point. The importance of knowing basic first aid cannot be overstated. It's a skill set that can make the difference between life and death. In this video, we're going to take you through the steps to handle 10 common emergency situations. Our aim is to equip you with the knowledge to help when help is most needed. Let's dive into the first emergency scenario: cardiac arrest. Imagine you're at a family gathering and someone suddenly collapses. When such a situation arises, it's crucial to stay calm and act swiftly. First, check for breathing and pulse, but remember to limit pulse checks to less than 10 seconds. If you can't detect a pulse or any signs of life, begin chest compression-only cardiopulmonary resuscitation, or CPR, immediately. This involves 30 compressions followed by 2 ventilations, either using a bag valve mask or mouth-to-mouth breaths. If an automated external defibrillator, or AED, is available, apply it as soon as possible and follow its instructions for defibrillation. If the AED advises no shock, or after a shock is delivered and there's still no pulse, continue with CPR. If there's no response to CPR and the AED, it's time to call for professional medical help. Remember, your actions might make the difference between life and death. Knowledge and prompt action are key when dealing with cardiac arrest. Now, imagine your friend complains of chest pain during a hike. This could be a suspected acute coronary syndrome. Symptoms might include chest pain, shortness of breath, or pain in the arm or jaw. If you suspect this, administer aspirin orally and nitroglycerin sublingually every 5 to 10 minutes if the systolic blood pressure is equal to or more than 100 millimeters of mercury. But what if the heart is beating too slow, too fast, or irregularly? That's a suspected arrhythmia. And then there's dyspepsia, a fancy term for stomach upset, which is typically characterized by isolated epigastric burning with no associated symptoms. This is a consideration of exclusion, supported by history of similar symptoms. In any case of cardiovascular distress, remember to stay calm, offer reassurance, and seek medical help immediately. Your actions can make a difference. Recognizing these symptoms early can prevent a catastrophic event. What if your colleague suddenly has trouble speaking or moving their arm during a meeting? This could be a stroke, a medical emergency that requires immediate attention. When it comes to strokes, the signs are often sudden. They may include trouble with speaking and understanding what others are saying, paralysis or numbness of the face, arm, or leg, particularly on one side of the body, difficulty seeing in one or both eyes, and severe headache with no known cause. If you notice these symptoms, it's crucial to note the time they first appeared. This information helps medical professionals determine the best treatment. Your immediate actions should be to ensure the person's safety and call for medical help. Administer oxygen if it's available. Remember, in a stroke situation, every minute counts. The sooner the person gets medical attention, the better their chances of recovery. Time is brain in a stroke. Responding quickly can save a life. You're at a concert and someone near you starts convulsing. Imagine that. Now what do? First, focus on safety. Clear space around the person to prevent injury. Don't try to restrain their movements, and for goodness sake, never attempt to put anything in their mouth. They can't swallow their tongue, but they can bite down on what's put in their mouth. Once the convulsions subside, gently roll the person onto their side. This helps maintain an open airway and allows any fluid to drain away, minimizing the risk of choking. Monitor their condition closely. Look for signs of recovery. Are they regaining consciousness? Are their vital signs stable? If a seizure lasts more than 5 minutes, or if they experience multiple seizures without regaining consciousness, it's time to administer medication if available. This could be their own anti-epileptic medication or an oral benzodiazepine. Stay calm. Seizures can be scary to witness, but your composed response can make a big difference. Now let's say you're at a baby shower and the expectant mother starts having contractions way too early. This could signal an obstetric emergency, situations which require immediate attention and action. Obstetric emergencies can vary widely, but 2 common types include vaginal bleeding and early labor. It's crucial to calmly and quickly gather as much information about the situation as possible. This could include the onset and detailed description of symptoms, along with information about the pregnancy, such as parity, gestational age, and any preceding complications. Vaginal bleeding during pregnancy can be concerning. If the bleeding is less than 1 pad per hour, expectant management is common. However, if the bleeding is heavy, ongoing, or severe, it's time to contact medical support immediately. Now, let's turn our attention to early labor. If the expectant mother is experiencing regular contractions or a sudden gush of vaginal fluid, it could be a sign of labor. If this happens during the 3rd trimester, one simple action you can take is to help the mother lie on her left side. This position can improve blood flow to the baby. But remember, if labor appears active, or the mother is in severe pain or bleeding heavily, it's critical to contact medical support right away. In obstetric emergencies, your quick thinking and action can help both the mother and the baby. Imagine you come across someone who seems to have overdosed. What do? The first step is to identify the type, amount, and timing of substances used. Keep an eye on their symptoms and mental status, along with vital signs. If the person exhibits signs like altered mentation, constricted pupils, or respiratory depression, it could indicate opioid ingestion. Similarly, slurred speech and behavioral changes might suggest alcohol ingestion, while tachycardia, dilated pupils, and agitation could point towards stimulant ingestion. If their vital signs are normal and there's no sign of respiratory compromise, observation is the best course of action. However, if opioid ingestion is suspected and the person is experiencing respiratory depression, naloxone could be administered. In cases of alcohol overdose, observation and antiemetic therapy might be needed. For stimulant ingestion, hydration is key. Remember, when in doubt or if the situation worsens, always contact medical support. Allergies can be life-threatening. Do you know how to respond to an allergic reaction? Identifying exposure to allergens is the first step, followed by noting the duration and severity of symptoms. Pay close attention to any signs of airway swelling, respiratory involvement, or systemic reactions like widespread hives. A localized pruritic rash or isolated hives typically suggest a local allergic reaction. In such cases, administering diphenhydramine, 25 to 50 milligrams for adults or 1 milligram per kilogram for children, orally is recommended. On the other hand, symptoms like airway swelling, respiratory distress, generalized hives, hypertension, nausea, or vomiting may point towards anaphylaxis. This is a more severe reaction requiring a different approach. Epinephrine, diphenhydramine, and steroids, if available, should be administered. Remember, in case of severe anaphylaxis, if there's no improvement, contacting medical support becomes absolutely vital. In severe cases of anaphylaxis with no improvement, contacting medical support is crucial. Accidents happen. Are you prepared to manage injuries? In the event of trauma, it's important to assess all injuries for any open wounds, tenderness, deformity, or active bleeding. In particular, if someone has sustained an injury to the head, neck, or back, be vigilant for any neurological symptoms. Next, let's touch on the management of active bleeding. Your first line of defense should be direct pressure applied with a gloved hand. For ongoing heavy extremity bleeding, you might need to consider applying a tourniquet. Now, let's talk about suspected long bone or joint injuries. In such cases, splinting material can be improvised from available equipment. For instance, a U-shaped, half-rolled magazine secured with tape can make a good forearm or wrist splint. Anything rigid can be used for legs. Remember, in case of severe injuries, seeking immediate medical attention is a must. Stay calm, act swiftly, and provide first aid to the best of your ability until help arrives. Breathing issues can be frightening. Here's what you can do to help. When someone is experiencing respiratory distress, the first step is to administer albuterol, a bronchodilator used to treat or prevent bronchospasm in people with reversible obstructive airway disease. Typically, a dose of 2.5 milligrams inhaled is suitable. If available, providing oxygen can also be extremely beneficial. It is important to stay calm and reassure the person that help is on the way. Now, if the respiratory distress is due to an allergic reaction, remember to review the steps we discussed earlier for managing allergic reactions. This could include administering medication like diphenhydramine or epinephrine, depending on the severity of the reaction. Remember, these steps are meant to stabilize the person until professional medical help arrives. If symptoms persist, contacting medical support is necessary. What if someone faints or nearly faints? Here's how you can help. A person fainting or almost fainting could be caused by various issues. A common reason is vasovagal syncope, where the individual appears pale and sweaty, but improves with simple measures in 15 to 30 minutes. Another potential cause is a heart problem, such as a heart attack, indicated by symptoms like chest pain, shortness of breath, arm or jaw pain, or persistent slow heartbeat. Pulmonary issues or a stroke can also lead to fainting. Look out for difficulty breathing, chest pain, slurred speech, facial droop, or arm weakness. Hyperglycemia or low blood sugar is another possible cause. If someone is sweating and has cool skin, use a glucometer to check their blood sugar if available. If someone loses consciousness, lay them flat, elevate their legs, and apply oxygen if available. If they seem to have had a brief fainting spell, have them lie down, elevate their legs, and give them oral fluids if they aren't nauseous. In cases of unconsciousness or persistent symptoms, contacting medical support is critical.